Okay, so let's continue. We have admitted that language is an integral part when it comes to intelligence. And we know that that is possible because of the brain, some specific part of the brain. In terms of processing, we were able to look at the Wernicke's, but somebody might decide to look at language in both input and output level. This is because in clinical practice, you'll be able to have individuals or patients with language disorder. So you need to be able to assess whether they are having an issue with the input or maybe they are having an issue with an output. And by now you are acknowledging that if you are having a problem with an input or an output, that will affect your communication greatly, to which again will reflect as a depressed level of intelligence, because we anticipate you to have your thinking process majorly supplied by the words or maybe language. So there are two aspects of communication. First is the sensory aspect that can also be referred to as the language input. This normally involves the ears, the eyes, and second, we have the motor aspect that normally involve the local vocalization and the control of the speech, the sensory aspect of communication. By now, we've suggested that this could be as a result of visual or auditory areas within the cerebral cortex. The auditory or the visual association areas of the cortex can result in the inability to understand the spoken or written word. This is especially if we are having a disorder in that particular area. So in those circumstances, we'll be having the specific description in terms of words to suggest that we are having inadequacy in both auditory and visual. So these effects are called respectively auditory receptive aphasia. So you've examined a patient and you are concluding that this patient could be having an auditory receptive aphasia, possibly because they are having an ear problem or maybe a problem at their auditory cortex. You can also have a visual receptive aphasia. This uh, uh, happens when you are having a problem with the vision, which can be translated just as pure blindness, or maybe you're having an issue with with the the visual cortex of the cerebral cortex. So this can be referred to as the visual receptive aphasia, word deafness, or word blindness, sometimes referred to as the dyslexia. Even though some people are capable of understanding either spoken or written word, but are unable to understand the thought that is expressed. That is what we are able to say. If you're having a competent auditory cortex and a competent visual cortex, you are able to grasp, but you are not able to interpret the meanings that are recorded in those words. So that is likely if you're having a problem with the Wernicke's. At this level, we can term this patient to be having Wernicke aphasia or Wernicke aphasia, where they are able just to see the words, they are able to hear the words, but they are not able to interpret. So this will also result into a communication disorder at the level of Wernicke's. So you are able to see how this is important. So when the lesions of the Wernicke areas is widespread and extend, it might involve the angular gyrus region. So when it involves the angular gyrus region, you know that it won't be able to incorporate some visual aspect of the language. Inferiorly into the lower region of the temporal lobe. So this to an extent might compromise the auditory cortex. Superiorly into the superior border of the sylvian fissure. So this might compromise some aspect of the somatosensory area that we also agreed that are very important in terms of feeding the Wernicke areas as it processes word into language. The person is likely to almost totally be demented for language, understanding, or communication, and therefore they are sometimes said to be having global aphasia. So the difference between global aphasia and Wernicke aphasia: a global aphasia is a representation of a worsened Wernicke's aphasia, meaning that Wernicke's areas was initially affected, but it spread to other regions. whereby it was not able to involve the auditory cortex. This person is not able to appreciate any sound, and maybe spread it to the angular region, where maybe these people are not even able now to adequately discern words from what they are able to see in written form. So this could be a global aphasia. A global aphasia, an extension of the Wernicke's aphasia. You can also have a problem with the communication at the motor level. So this is to suggest that maybe this person understood what was written, what was said, but they are not able to express it back. Remember, when you are talking of communication, it is normally a two-way traffic. I'm only able to know I communicated if I get a response. And remember, the response could be verbal and or non-verbal. But the response here that we are interested in, it is likely a verbal response, which should be able to be executed by the Broca's area. So the Broca's areas within the cerebral cortex should be able to control the movement of the mouth, the tongue, and the vocal cords, so that we are able to form words. So remember, you're having a thought, but you want to code these thoughts into words, so that the external people can readily understand what you are saying in a much specific way. So remember, not everybody can read somebody's mind. So you just need to use words to know what is in your mind. Of course, you'll be able to see later on that in as much as somebody is saying something, a lot of things are not said, and they can be said indirectly by the way this person is expressing themselves and non-verbally. But here we are focusing on the verbal. So the process of speech involves two principal stages of mentation. So mentation, just the mental process. Formation in the minds, thoughts to be expressed, as well as the choice of words to be used, and then that should be with the Wernicke's. So remember, the words that you had need to be transformed into thoughts, because as you are communicating, remember, it is two individuals are involving themselves. So somebody throwing to you words, these words you need to process them into thoughts. That is charged by the Wernicke. And that and remember, when you are using this, when you are forming these thoughts, again, it will be dependent on the working memory. So once you have these thoughts, you want to have several thoughts from various places. We are assuming one of the major is from the Wernicke's. Of course, you should be also be having some thoughts from the back of your mind, so that you don't just become, let's say, a mirror. You just give out what has been asked, but you are able to modify the communication or the thoughts based on your past experience, which are stored possibly in your hippocampus or um, uh, the remote sensory part, or the remote part of the memory. And after having that, you should be able to now vocalize the words, and this is affected by the Broca's area. So remember, Broca's is also part of the premotor association area. Remember, after the Broca has been stimulated, now it will involve the specific motor area, or it will stimulate the specific motor area, so that we are able to stimulate the upper lip, the lower lip, and also the specific motor that should be aiding with the contraction and the relaxation of the vocal cords. So that represents the motor part of the communication. So in summary, the communication sequence follows this. So this is, if you summarize both the sensory and the motor aspect. Reception of the primary auditory area of the sound signals that encode the words, interpretation of the words in the Wernicke's, determination also in the Wernicke's areas of the thoughts and the words to be spoken, transmission of the signals from the Wernicke's to the Broca's area by way of arcuate fasciculus, activation of the skill motor program in the Broca's areas for the control of word formation, and transmission of the appropriate signals to the motor cortex to control the speech muscle. So if you become a speech specialist, one of the areas that you'll be interested in, it is in this pathway, right from the sensory inception by the Wernicke's, how it communicates with the brokers, how it's able to pick now, have the specific words to be used, and then brokers communicating to the primary motor area, where some specific motor neurons can be stimulated to go to the specific muscles that normally assist in the communication. So this is that mapping, as we've been able to suggest. So everything, of course, assuming we have the eye over here, we are having the ears to the specific area, auditory area, possibly at this level. Let us extend it a little bit. The visual area. So once we've had information from our ears, our eyes, they'll be taken to the angular gyrus. This is specifically vision. Once in the once here, they'll be taken to the Wernicke's for processing, or maybe now for decoding. Remember, words are codes. So you want to decode them so that you get the thoughts that was there in the other people's mind. So having those thoughts, these can be taken to the Broca's area, where the Broca's area again codes these thoughts into words. So they'll be able to, by the time the information is leaving the Broca's area all the way to the primary motor area, we have deliberately chosen some of the words that we want to utter. So the words, with the words, the body is very intelligent, or the mind is very intelligent, knowing the specific muscles that should be contracting and relaxing to be able to execute that. And this is likely to be executed by the primary motor area. Remember, the primary motor area was also arranged in homoloncus, and we are able to see the specific part within the body that are controlled by the specific area. So it means that from here, we'll be able to explore, or we'll be able to recruit a specific area, and maybe just to tell us, maybe important depending on how you look at it. You see, whenever somebody is telling you something, let's say not necessarily a speech, but you are engaging in terms of communication, whenever they are talking by word of mouth, they are able to express themselves verbally. But you know what is important? It is the nonverbal communication. And this is can be utilized by many professionals to tell whether somebody is lying to an extent. This is because there are some choice of words that you want to use. Some signal will go to the specific motor area that should be stimulating the mouth to give us the verbal expression of some word. But simultaneously, we might also get some signal from this area spreading to various parts, possibly the hand, so that you express yourself non-verbally. So we are able to say you are telling us the truth if the non-verbal and verbal are congruent. They are telling us about the same thing. We are able to say you are lying if the verbal and non-verbal are incongruent. So whereby you cannot be telling us something that is tense, but non-verbally you seem so relaxed. It is natural that when you are expressing yourself with a certain word that also has some emotional appraisal in it, you should also be having an equivalent non-verbal expression of the same. So you just need to note that. Another thing that you had suggested, remember, when you talk of the Wernicke's, when you are talking of the Wernicke's and the non-dominant part of it, of the Wernicke's, this is normally one-sided. But at the end of the day, we want to take this, we are receiving some sensory impulses. some from the right, some goes to the right, some goes to the left. But at the end of the day, we want to have a unified form of reply or a uniform motor. So that means within the cerebral hemisphere, we should be having some form of communication. So what we might have known, we normally have the corpus callosum that seeks to connect the major left and the right cerebral hemisphere. So we'll not be worried. Even if we are having our left part being dominant, it means that dominant, it means that if you are having some sensation from the right part, we are able just to communicate adequately, so that if you act, we won't say that this time you thought you are just thinking by the right part of your brain and not the left. We are not able to say that most of the time. This is because we are expecting some form of communication. So this is aided by the corpus callosum, at least for the major chunk. We also have some communication just at the inferior part, where we have what we call the anterior commissure. Anterior commissure seeks to connect the temporal lobes, seeks to connect the temporal lobe. So just a minute, give me like 5 minutes. I'm having somebody over here. So we are suggesting that we have two types of communication. That is the corpus callosum and the anterior commissure. So where the anterior commissures will be majorly connecting the temporal areas. So fibers in the corpus callosum normally provide abundant bidirectional neuronal connection between most of the respective cortical areas of the two cerebral hemispheres. So apart from the temporal regions, so remember the temporal regions are likely to be on the inferior part. So this, for them to be connected, they rely on this other connection regarded as anterior commissure, that normally tends to seeks to connect some of the limbic organs. So where you're able to see something like the amygdala, so that by the end of the day, we can have information integrated between the left and the right part. So there have been some experiments that have been performed to emphasize on the importance of both corpus callosum and the anterior commissure. For example, the role of the corpus callosum is well demonstrated in experimental studies. This involves the longitudinal splitting of the corpus callosum and the optic chiasma of the monkey. So that means if you split the corpus callosum, to an extent, we don't anticipate communication between the right and the left part. And remember the role of the optic chiasma. So the optic chiasma again is able to integrate both the visual sensation from the right and the left eye. So in the first experiment, both corpus callosum and the optic chiasma is split, whereas afterward, one eye is blindfolded and the other one is left. It is trained to recognize the object with the open eye until it is able. So that when the other eye is open and the other blindfolded, it is no longer able to identify the object. So that telling you it is likely the monkey was only able to identify an object with one eye. This is because all the information that was identified, but that was taken with one eye, was only registered to a specific part of the, to only one side of the visual cortex. And there was no communication. There's no communication because the corpus callosum was split into two. And therefore, when the other eye is blindfolded and you only deal with one eye, it means that you are only incorporating data into one specific storage area or one cortex appraisal area, the visual cortex. And therefore, when the other one is opened and you blindfold this initial one, it won't be able to recognize the object because it will deem it as something that is new to it. And this is because the scientist was able to split the corpus callosum. However, when the corpus callosum is paired and the optic chiasma is split still, so remember the optic chiasma allows you to integrate some visual sensation before they get into the visual cortex. If in the second experiment, corpus callosum was paired, optic chiasma was split. With the similar experiments, both eyes were able to recognize the object. So this telling you that in as much as the optic chiasma was split into two, the information was able to get into the visual cortex. But despite you blindfolding this other eye, it means because of an intact corpus callosum, the information was able to be shared between these two aspects. So if you are storing an information by the hippocampus or whichever part, it will store an information that is recognized well by the right part and by the left part. So despite you folding this other eye, when you reopen this other eye and close this, it will still be able to recognize this object despite you blindfolding it initially. So this is an experiment that was done to affirm the important role of the corpus callosum. So that means that even if you are having the left part as the dominant part, information getting through the right can still flow through the corpus callosum, thus emphasizing the role of the corpus callosum in the cerebral connection in the corresponding area of the hemisphere. That's one of the functions of the corpus callosum and the anterior commissure. Okay, just a minute, sorry. So the role of the corpus callosum and anterior commissures allows us to have a communication between the two cerebral hemisphere. So let's get into thoughts, consciousness, and memory. So by now we've said that if you take these words, either verbal or through written, you can be able to decode them back, to decode them so that they become thoughts. So let's understand some of the specific mechanism revolving around thoughts, consciousness, and memory, just in a gross way. So understanding the consciousness, thoughts, memory, and learning is very challenging because the exact neural mechanism behind them it's often unclear. So just like with the wordings or maybe just like with the cerebral cortex mapping, the evidence are only apparent when there's a specific damage to an area within the cerebral cortex. So it is with the deficits that you are able to really suggest the importantness of a specific part. Those involve simultaneous activation across multiple brain regions, notably the cerebral cortex, the thalamus, limbic system, reticular formation. Some thoughts like pain rely more on the lower brain centers, such as the hypothalamus and the amygdala, while some complex thoughts which require visions normally use the cortical part of the cerebral. Provisional definition suggests that a thought is a pattern of neuronal stimulation across different brains area. This is known as a concept of holistic theory of thoughts. So I want you to remember when we were talking about the working memory, so that is, this is information stored temporarily within the prefrontal area. So a lot of information. So this process of deciding which information to use and all this process is what can be summarized as thoughts. And remember, during the thinking process, you are not only using the words and the words in vision or in auditory form, you are also involving some of the stored information within the remote storage area of the brain. So that process of deciding what to use, or that decisive process, is what is referred to as the thoughts. And remember, we have various types of thoughts. So we have thoughts that are likely to involve a lot of logic. So those with a lot of logic are likely to use the cerebral cortex, while those that are essentially emotional kind of thoughts are used likely to involve the brainstem area, where we have the reticular area that is a major area. So when you think of thought, it is not just a specific part, but we are having many parts neurologically connected. So this is what you can refer to as the holistic theory of the thoughts. So in this framework, we have the lower centers shape the emotional and general qualities of the thoughts, like thoughts of pain, thoughts of pleasure. And remember, when I'm talking about pain or pleasure, I'm specifically ignoring the logic part of it, because sometimes there could be some pain or thoughts about pain that involves maybe logic. A logic making no sense. Just think of a police officer who is about to maybe torture somebody, and they are coming with specific mechanism of inducing pain. So even though they are thinking around pain, they'll be using the cortical part of it, because they are just about to evoke pain. But if they are the subject, or the subject where the pain is being inflicted on, these people, their kind of thoughts are likely to be confined within the lower centers of the brain, majorly the reticular area. And I don't know if you are able to remember, we suggested that we had two types of pain, the fast pain and the slow pain. We suggested that the slow pain are likely to end at the brainstem, the reticular area. And it has the brainstem, or maybe with the slow pain, we suggested that most of the time it normally has a lot of emotional component, in that it is likely to stay there for long. When it stays there for long, it is likely to present with some suffering and some behaviors that suggest some thinking process revolving around the emotions. So two frameworks at the lower centers. The higher centers are normally charged with a logical approach of thought. So the cerebral cortex defines specific features. For example, location of the sensation, texture, visual patterns. So these thoughts, or the thinking process under the cerebral cortex, likely to have a lot of maybe evidence. So lastly, consciousness is seen as an ongoing awareness of either external or surroundings or internal thoughts of sequences. So this is to say that if you are aware of a particular thought that is ongoing in your brain, that will be deemed as we'll say that is a conscious thought. But sometimes you might not be aware of the thoughts that are currently ongoing in your brain. So that will suggest that you are having an unconscious thoughts, whereby let's just state this simple fact: an individual is likely to act out of maybe some thoughts. So maybe let's say you are seated and you decide to stand. I'll use the example of standing over and over again. You decide to stand. Maybe you can be standing because you wanted to pick something. So you've decided deliberately to stand. So this is a conscious thought. Conscious thoughts always serves a specific purpose that the individual is aware of. So the awareness of the purpose is there. because it is from these thoughts that the motor area is able to read and give us an execution. So one of the execution is like standing up. But you need to know, sometimes you could just be seated and stand up, and maybe at the back of your, not at the back of your mind, after standing up, you'll be wondering, what was I supposed to do? Or what was I supposed to do? Or why am I even standing in the first place? You are not able to know this. Why? You are not able to tell the whys. This is because we are not suggesting that there are no thoughts. There could be some thoughts at an unconscious level that is prompting this particular type of behavior, the behavior of standing up. But you might not be aware of it. A good example is, I want to stand up to pick something, possibly walk out of the class because I'm supposed to do ABCD at some place. So that is a conscious thought. You'll stand and go and execute that. Sometimes maybe you might stand up without knowing, maybe because you are responding unconsciously to a stimulus. So maybe there's a disgusting smell within an area that you are in. Sometimes when you can appraise that consciously, but sometimes not. So you might find yourself walking out of a particular place because of some discomfort, emotional discomfort, and end up standing without really acknowledging what happens. So that is part of consciousness. So consciousness is just the awareness of something. And remember, the awareness of something reduces when you are sleeping. When you are sleeping, you are unconscious. When you are in a coma, you are unconscious. When you are dead, you are dead, but not unconscious. So remember, when you are sleeping, you can be aroused by the physical stimuli. An alarm can wake you up, but when you are in coma, you are unconscious, but an alarm will not wake you up, so you are not arousable. So another modality of intelligence is memory. Memory is very important, and for now I want us to examine some of the biophysical processes that are likely to take place within the brain, so that we appreciate the psychological part of the memory that we normally interact with. So let's examine the role of synaptic facilitation and synaptic inhibition in the formation of memory. So this is just borrowing from the simple neuronal mechanism that we are able to introduce while covering the different circuits that we are able to see. So memories are stored in the brain by changing the basic sensitivity of synaptic transmission between neurons as a result of previous neuronal activity. The new or facilitated pathways are normally called the memory trace. They are important because once traces are established, they can be selectively activated by thinking mind to reproduce the memories. Memories can form at all levels of the nervous system. It doesn't need to be the brain. It can also form at the spinal cord level. So remember the reflex, where you are just able to act in a particular manner, where if you get the same stimulus, you'll still be able to react in the same manner. This is possible just because the information was somewhere stored. It doesn't need to be at the brain level. Sometimes it can be at the spinal cord. And remember, this kind of memory, these are not memories that you cannot be able to access because you are not conscious of it. And anatomically, it is making sense because it is not at the cerebral cortex level. This adaptability is part of the memory process. So remember, we were talking about the synaptic adaptation. So synaptic adaptation can also be a mechanism that can again explain a memory. So from a simple fact like this, you're having a neuron with its axonal end, possibly releasing some neurotransmitter, interacting with the neurotransmitter, interacting with another receptor of another neuron. So how do we form a memory? So memory is likely to be formed when we are having an impulse Remember, impulse, a good example of an impulse may be a visual impulse, where you want now to remember that visual impulse. This will trigger the release of neurotransmitter. So for us to have a memory, we need to increase the release of neurotransmitter. So if this kind of sensation happens in a way that it increases the axonal vesicle to release more neurotransmitter, we'll be able to store some, we'll be able to have some memory over here. Unlike if an impulse passes, but we just release the normal amount of neurotransmitter that are normally anticipated. So the increment of neurotransmitter, remember, is one aspect of the adaptability when it comes to receptors or the sensor or the synaptic receptor. This is because the sensitivity of this receptor will increase because we are increasing the amount of neurotransmitter. So if the neurotransmitter increases or the sensitivity increases, we'll say that a memory has been somehow been formed. And as maybe if you allow yourself to think of this way. So what determines if you'll be able to store to form a memory or not? That means you'll need to go beyond the ordinary impulses that you normally receive. So that is to suggest that whatever signal or an impulse that is passing needs to be of somewhat a higher intensity to be able to stimulate more neurotransmitter to be released. And that might translate well when there's a lot of motivation in terms of sensation that is coming, or how somebody is glued to a particular stimulus. Another way to suggest this will be, so let's say there's somebody who has just glanced at this slide. So if they've just glanced at this slide once, it means that the amount of impulse that will pass through will not be as high compared to somebody who is just staring at this slide, and maybe they are trying to make meaning of everything that is in this slide. So that means they'll be having a lot of impulses passing through the same neuronal tract. So these impulses that are passing in large magnitude are likely to translate into increased release of neurotransmitters, which is likely to increase the sensitivity of the receptors at this level. And therefore, what does this mean? This means that a lot of neurotransmitters increment in the sensitivity, we are likely to have what we call now the memory trace. The memory trace. So this is the simple mechanism of the synaptic facilitation for the memory formation. While long-term memory involves lasting changes in the synaptic conduction in the lower brain area, the intellectual memory, we commonly refer it to the primarily depending on the memory trace in the cerebral cortex. So this is a good definition of the working memory. Why is it a working memory? We suggested that working memory is normally there temporarily. And to a neuronal level, you can also explain the temporarily aspect. This means that once the neurotransmitters has been released at the synaptic cleft, we can also have some enzyme that will actively degrade this neurotransmitter. So remember, our important neurotransmitters as far as memory was concerned was acetylcholine. Acetylcholine, if it is there in adequate amount, the memory will be okay. But if the neurotransmitter reduces, the memory also can reduce. So in matter of working memory, where it is normally on a temporal basis, the neurotransmitter once released even with adequate stimulation, they are likely to be degraded by the, of course, acetylcholinesterase that should be around this area. So means after the degradation of this neurotransmitter, the memory trace will also be reduced. So this is a good representation of the working memory, whereby as individual, as per now, we should be asking ourselves, if this is the working memory, what can the individual be able to take this working memory into maybe intermediate and possibly into the permanent storage system. So for the working memory, this is the simple mechanism. Memories are likely to be stored in traces neurotransmitter where we are increasing the sensitivity of the receptors. So for us to transition this memory into from working into long term, it means that we need to have some specific anatomical adaptation so that we have a permanent, we have this place remaining at this state in a permanent way. Because if the sensitivity or the level of neurotransmitter remains in a permanent way, it also suggests that the memory will also be permanent. So that is the synaptic mechanism for memory storage that will apply more to memory. So some specific aspect within the memory, we have some positive and negative memory. So all these are very important. The positive is a representation of just said. How memory are likely to be stored in memory traces, because some impulses, some visual impulses, remember it's an example, passing to a synaptic area, increasing the release of neurotransmitter that might increase the sensitivity of that neurochemical connection, and this will allow some memory to be stored. It is good to remember that not every memory will be stored, or not every visual or not every sensation will be stored into some memory. Some end up being disregarded, and that becomes negative part of the memory. Remember this part is very important. Without this part, it means that every sensation that you experience every day will be stored in your mind. And remember, just like a computer, it means that the capacity of your mind will be surpassed. Akili yako itakuwa imejaa and it won't be able to store anything else. So it means that in future, if you interact with something that is important, they won't be incorporated because your mind is full. So that means your brain should be having a mechanism for acknowledging what is important and disregarding what is not important. What is important is likely to be now the positive memory, taking the sensitization part of it, where you are increasing the level of neurotransmitters that increases the sensation of the postsynaptic receptors. But for maybe some sensation that they are not of any psychological or maybe personal importance to you, they are not likely to be to increase the release of neurotransmitters. In fact, what is likely to happen, it is likely to limit the amount of neurotransmitters that will be released. So rather than increasing the neurotransmitters will be released in a subnormal way, so that it won't be possible for it to capture some information. So although we often think of memories as being positive recollection of previous thoughts, experience, probably the greater share of our memory is negative and not the positive. This is because we've suggested that our mind or our brain does not have the capacity to store everything in this, everything that we interact with in this world. So it means a lot of things we need to ignore. And this might explain, maybe sometimes you've read something and possibly you didn't remember. The only reason why you are not remembering is because your mind was able to see that thing as not important. So if you read something that is not important to you, maybe reading because of formality, you'll definitely forget because your mind has a way of protecting you from excessive information that is not important to you. And that introduces a very important aspect of learning. That means if you are to learn something and to retain it, you also need to develop, or maybe you need to personalize that kind of information. That means I know we are not engineers, and therefore, if you hear some scientific concept revolving around physics, you are not likely to grasp it. This is because you don't think of yourself as of an engineer. You are thinking of yourself as a clinician, and therefore you'll be more receptive to biological concept than physical or with a mathematical or physics concept. This is because there's some form of emotional attachment that you have in regards to whatever you are reading. So that kind of connection can also be very important, and you also need to note it. If that is not the case, where the information you are reading or you are listening is not important to you, your brain will automatically have what we call the habituation of the synaptic transmission. That means we'll be able to inhibit the synaptic pathways. And this is what we call the negative memory. You studied for 3 hours, but you got nothing out of it. This is because you are reading something that you are not emotionally connected to. For example, if maybe you are, let's say you are a Buddhist, and maybe you are reading Quran, something like that, you might not be able to remember anything because your beliefs and maybe your interests do not revolve around Islam, and you might not remember a fact of what you read. This is because you'll be well protected by the negative memory. So you should ask yourself, does the negative memory work in your favor or against you? If it's against you, you need to personalize whatever you are studying so that the mind gets the essence, and then rather than giving you the negative memory, it gives you maybe the positive memory in place. And with that, we'll be able to say that at least you'll be able to remember most of the things. So the main reason why you're having negative memory is to protect your capacity. We know we don't have a lot of storage. So conversely, for incoming information that causes important consequences, such as pain, pleasure, the brain has a different automatic capability of enhancing and storing the memory traces. And when we are talking of personal importance of the incoming sensation or whatever you are reading, it doesn't need to be on a happy note or on a euphoric note. It can be on the dysphoria note. For example, you can be able to remember the taste of an alcohol that is somehow bitter than the taste of water that is somehow tasteless. Even though we have some other aspect, you don't remember the taste of water, but you want to know whether it was cold or not to quench your thirst, something like that. And you can remember maybe some taste of a sugar more easily than the taste of water, and the taste of the alcohol more easily than the taste of the water. This is because we are having some significance with this sensation. So this sugar is giving you some form of pleasure. So this is the emotional connection that we are suggesting. And this alcohol maybe cause to some people is some pleasure, but let's assume you don't like it. It will give you some form of discomfort, and you are able to remember, me, I don't want a taste that tastes like something like taste that tastes like alcohol. and I just want something that tastes like sugar. By the fact of just saying that, it means that you are able to remember. Next time, if you take something bitter, you'll be able to remember. Something sugary or to a pleasant extent, you'll be able to remember. And that's how the memory somehow it's working. That is, if you compare even just with the working memory, where we are having the positive versus the negative. So what we are discussing, we are just having a deliberate way of shifting from the negative into positive. So how do you make sure you are able to get a memory, at least even at the working level? Because sometimes you read and you don't get nothing, you don't get something out of it at all. Even at the working memory, where you should be now be able to internalize what you are reading using these thoughts that are stored in the memory, in the positive, or rather in the working memory, you might not be able to do that sometimes. Just this could be if you are having the negative memory overwhelming, or with the habituation or the inhibition that we are suggesting. So this is the positive memory, that which has some meaning. It results from the facilitation of the synaptic pathway, as we suggested. Special areas in the basal limbic regions of the brain determine whether the information is important or unimportant. And that's why the limbic system is very important in memory. Not because of the hippocampus, we can ignore that at the moment, but think of it like this. Limbic system, or the limbic region, represent an area where we store a lot of emotions. So if whatever you are consuming uh, does not trigger some form of emotions in you, you are not able to remember it. And that is the basic. So special areas in the basal limbic regions of the brain determines whether the information is important or unimportant. So that means at the working memory that is partaking at the prefrontal cortex of the brain, you should also be having a direct connection to the limbic cortex, possibly in the temporal lobe. From there, that advances into the specific limbic organs or structures, such as the amygdala. So the amygdala, these are very important area for the storage of emotions. So whether something is reminding you of an happy thing or a sad thing, you are able to store it at least temporarily as the working memory. But if it is something that is not making sense emotionally, you are not able to store it. So that also applies to reading. So if you are reading, or maybe having some auditory consumption of concept, if these things does not appeal to you, you are not able to get it. And that's why maybe some people might suggest that before, not really before, somebody who has watched maybe movies that revolve around medical movies with some medical concept, so they are likely to have some form of emotions already stored. So it might be easier for these people to learn some medical concept than somebody who has not been maybe exposed to some movies, not necessarily movies. Maybe they have not been exposed to hospitals. So that's why sometimes people can suggest that by going to the ward, you might not be learning directly, but by going to the ward, you might be forming some emotional connection, or you might be having some emotions parts that will allow you to receive more, that will allow you to receive easily some medical concept. This is because you went to the ward, you are able to interact with the patient, you are able to see the patient with the disease, and maybe because of their suffering, you are able to remember what you saw at an emotional level. So that means if you learn a concept, scientific concept, like let's say malaria or pneumonia, you are able to relate it to the patient who you saw who was really suffering, unlike somebody who has never gone to the ward. So if this person has never gone to the ward, or they do not have any emotional connection to the concept that they are reading, they might have a difficult time forming memories than with these individuals. And that's why we are suggesting the limbic part also becomes a very important part in determining which sensation is transition into memory and which one is not. So you might be reading and you're seeing words flowing, but at the end of the day, getting nothing because your limbic system has blocked you, because whatever you are reading, you've never had a classical or maybe a clinical or a practical thing that you can relate to that information. So this can be very important. You are discussing malarial concept. You are able to get it because you are remembering a patient who had malaria and had ABCD. So just know how that can be very important and how you can take advantage of it. So how do you classify memories? So we've been able to examine how memories are stored. That is specifically the working memory, which can be shorter than the short-term memory, meaning that these are memories that you just want to act on. So memories can be stored or memories can be classified based on various criterion. We have two major criterions. One criterion that majorly respects time, where you can classify memory as short-term memory, intermediate long-term memory, and long-term memory. And by now we know that if you translate this physically, it means that by the time you're having a long-term memory, it will somehow be permanent. And it also means that equally, you should also be having some physical permanent structures within the brain that suggest that reflects on the memory level. So for example, the short-term memory, psychologically, this can be described as a memory that lasts for seconds or minutes unless it is reinforced into long-term memory. Intermediate long-term memory, somewhere between the short-term and the long-term memory, lasts for several days to weeks, but may gradually fade. So I want you to think of it in this way. We suggested that you're having an impulse, this impulse allowing you to release some neurotransmitters. So when these neurotransmitters are released in great amount, the sensitivity increases. So when the sensitivity of the postsynaptic receptors increases, we'll say that we've formed a memory. And this is a representation of the working memory or the short-term memory. So how do you transition this memory into long-term? Physiologically, this can be explained in this way. We suggested that once the neurotransmitters has been released, we normally have some degrading enzyme that normally degrades these neurotransmitters. So how do you compete with these enzymes, or how do you compete with acetylcholinesterase? You are able to compete with it if you are having multiple stimulation of this area. So if you are having multiple impulses passing through this particular area, it will mean you will be able to release a lot and a lot of acetylcholine to an extent that whereby this acetylcholinesterase won't be able to match your speed of release. So it is the speed of release versus the speed of degradation. And that's why we are suggesting that you are able to transition from the long-term memory into from a short-term memory into an intermediate memory when you reinforce whatever, when you are having some form of reinforcement. And reinforcement to this level might be maybe you are reading a concept repeatedly. You could be reading a concept repeatedly, or maybe a concept that relates to whatever you had learned in a more repeated way. So that will ensure continual impulse transmission. And when there's a continual impulse transmission, that will also ensure continuous release of these neurotransmitters, whereby we'll be reinforcing, whereby you are likely to have your stresses for long, or this neurotransmitter with increased sensitivity for long. With the time, if you don't rehearse, or yes, if you don't rehearse or if you don't read, it means that with the time, the level of neurotransmitters will reduce. Why are they reducing? It is natural for us to have the acetylcholinesterase degrading these neurotransmitters, or the acetylcholine. So that means if this memory again is not rehearsed, it will gradually fade over weeks. But how did it extend to weeks in the first place? This is because you are able to think through the same thing over and over again. So if you think through over and over again, you ensure continuous supplies of the impulse. But with time, it will degrade if at all you don't rehearse repeatedly. And sometimes it is understandable. This is because this is not the only thing that you can think of in this world. There are many other things that you'll be thinking about. So in the process of shifting your attention to some other things, it means that this information might fade naturally. So we also have long-term memory. So that means sometimes this information can persist and they can be stored for months, years, and even with a lifetime. So what difference are we able to see by the time you're having a long-term memory? So in the long-term memory, we anticipate to have some new new neuronal connection. Let's say this is the working memory of the short term. We've been able to suggest the intermediate. So the difference that we are able to see with the long term is that we might actually have some permanent neuronal connections, many permanent neuronal connection. So it is this permanent neuronal connection that is likely to translate into some long-term memory. So additionally, just remember, as we classify memory based on time, the working memory can be a part of the short memory that you are able to remember something as you are just acting upon it. The moment you stop acting upon it, you just forget immediately. So additionally, working memory, often discussed in the prefrontal lobe, is a temporary form of a short-term memory used for reasoning during task and discarding once the task is completed. So remember, reasoning is just a comparison of facts or a comparison of memories. So all these memories, you want to chunk them at the working memory, or if you translate this to a computer, at the random access memory, or that the working memory, where it can be just be accessed temporarily, and when they are not used, the memory taken back maybe to the long term, or if they were not stored, and they just disappear like that. And next time you interact with it, sometimes you might not even remember if you've ever interacted with it, depending on some other factors. So memories can also be classified based on their quality. Memories can also be categorized by the type of information, that is part the aspect of quality. We have the declarative memory and the skill memory. So at least with the declarative memory, you are able to, you can verbally express yourself. This is because these are memories of facts and events. For example, if you know the Constitution, you can easily tell us the article and the specific clause. That is a fact. You can also have the memory, like for now you are there in the class. Whatever is happening is an event. Later, you can be able to reproduce that event, telling us the specific things that were happening, how things were positioned, the specific time, what was taking place. So this is a declarative memory. you are able, the memory of facts and the memory of events. So this includes surrounding, time context, the causes, meaning of events, personal conclusion or the thoughts that were there during that particular time. You also have the skill memories. So this involves the learned motor skills like playing tennis. So with this, at least you don't need to think through them. You don't need to think through them. They don't need to follow some conscious logical pattern. So this could be visual tracking of the ball, estimating the speed and the position, coordinating the body movement, performing learn responses quickly and automatically. So you cannot teach somebody easily, or you cannot easily teach somebody this, but maybe you might give them a specific procedure and you'll assure them of learning after repeating these things. So they are only stored after some repetitions. And when we want to bring them out, we will not necessarily bring them through the working memory and know that now I want to estimate the speed of this ball. It is coming at this particular speed. So let me position my hand and let me relax this particular area. It is not likely to happen like that. These are just likely to revolve around the motor skill. So the short-term memory. So this is as what we suggested. So short-term memory allows a person to remember small bits of information, like around 7 to 10 digits. A good example will be words in a sentence, where you can remember that. If I tell you something like the presynaptic facilitation or inhibition, neurotransmitters have specific synapse, you can be able to remember that. And of course, if you don't rehearse it, within a second, you'll just forget, or within some few seconds, you'll forget. So there are two main theories explaining how short-term memory works. It can work through reverberating circuits. So remember the neuronal circuits. One of them was reverberation or oscillatory circuits. A good applications, we are seeing it in memory, whereby we suggested you need to have some continual impulse flowing so that you release the neurotransmitters to enhance the sensitivity. Well, this is possible in our it can also be possible through this reverberatory circuit, where we suggested that this axon can sprout out and excite this particular area, where it also has their excite this area so that it allows to release this information. So sometimes you could be having a good memory just because of this good arrangement over here, as we are able to see, where you'll be having an unending electrical stimulation. An unending electrical stimulation at this synapse equates to increase or a sustained sensitivity that is likely to represent the memory trace. So one of the hypotheses why you could be having memory stored, not necessarily short term, it can also apply to the others, but at this context, short term memory could be because of some specific anatomical arrangement of the neuronal circuits, either reverberating circuits or the oscillatory circuits. Another mechanism, it is through the presynaptic facilitation or the inhibition. So the facilitation, remember, it is good for the positive memory. So that means rather than us having this oscillation over here, we can also be having another how do we call it, neuron with the axonal end, where they're also releasing some neurotransmitter. Remember our facilitated zone, the way we discussed it? So this means this receptor is likely to be stimulated, or this neuron is likely to be stimulated because we are having more than one neurons or more than one axonal end releasing neurotransmitters. So this is also possible because of some facilitation. So facilitation increases the release of neurotransmitter because we have more than one axonal end. Reverberation also increases the release of neurotransmitter. This is because we are having continual stimulation at this particular area. So the physics or the physiological explanation of the short-term memory could be revolving around the reverberating circuit or the presynaptic facilitation. The inhibition, remember, it is serving the negative memory. So we are not dealing now with the negative memory, but we know it is very important because we don't want our mind to be full. We want to delete what is not important and incorporate what is important. And this happens especially when you think of maybe some improvement in technology or in some protocol in terms of treatment. Long time ago, if people used to be treated with a particular drug, there'll be some improvement. So when the improvement comes, you incorporate now the new aspect of treatment, and possibly you'll want to delete whatever you had in your brain in regard to the old information. So it means that you won't be revisiting, you'll not be revising it, you'll not be revising it every now and then, and it means that with the time that information might decay. If it doesn't decay, your mind capacity will be exceeded. So that is just in the theoretical terms. We also have the intermediate long-term memory. So for it to be possible, everything that we've seen in the short-term memory also still needs to happen. The reverberation and also the facilitation. But on top of that, something more needs to happen so that we sustain this memory from the short term to long term. And what is that? The intermediate long-term memory can last from several minutes to weeks. However, these memories are not permanent and might fade away or will fade away unless reactivated enough to become a long-term memory. So studies in simple animals show that these types of memory, through temporary chemical or physical changes at synapse, either in the presynaptic terminals on the postsynaptic membrane, these changes can sustain a memory for minutes to weeks, highlighting the importance of synaptic modification in the memory changes. So to translate this into physiological mechanism, you can summarize this and say it is only possible to have some intermediate long-term memory because of sustained chemical change at the synaptic space, whereby for the short term, we only have an increment in the sensitivity. So the sensitivity will increase if the neurotransmitter increases, but you know, if the level of neurotransmitters reduces, this memory fades away. But with the short term, we have a way of sustaining the chemical release. And again, this is possibly through the reverberation and the reverberating, that is, and the facilitation. So that means reverberating and facilitation is more obvious in the intermediate long-term memory. Whereby, just like what you've suggested, the intermediate memory is only possible because of the some synaptic chemical changes. So an experimental studies over here. So research by Campbell and colleagues, particularly in the sea-nail aplysia animal or organism, showed how memory can last from minutes to weeks due to chemical changes at the synapse. So there are two key synapses, the sensory terminals, from the sensory neurons to the postsynaptic neurons, and we also have the facilitator terminals, ends on the sensory terminals. So whereby when we are talking of the intermediate, our major part is with the positive, the facilitation, even though we know that habituation can occur and you'll end up forgetting. And how is this possible? This is possible the way we suggested. If whatever in the working memory or whatever in the short term does not have an emotional importance, or not even emotional, does not have some personal importance. But if that is the case, the facilitation will occur. If there's no any limbic appraisal, it will not occur. It is only the habituation. And the habituation, that means we'll have the synaptic chemical changes, not on the positive part, but on the negative part, where we'll be able to reduce the amount of the neurotransmitters. So when the sensory terminal is repeatedly stimulated alone without the facilitator, the signal weakens over time until it nearly stops. This reduced response is called habituation, a way the brain is able to ignore repetitive, insignificant stimuli. So that means even if it qualified to be part of the working memory because of the repetition, it won't qualify to be part of the intermediate. Because for it to be in the intermediate, we need to have some form of reinforcement. And remember, much of our reinforcement could be coming from the limbic system. So if we rush into the diagram, we can be able to see what we are suggesting with the facilitation. So this is a facilitation over here. So before we explain this, back to our text over here. So we have two mechanisms. It can be habituation for the negative memory, facilitation for the positive memory. So for the facilitation, if a noxious stimulus activates the facilitator terminal at the same time, the signal strengthens instead of weakening, and that means the memory is likely to be sustained, and it can persist for minutes, hours, or even weeks. And I want you to look at this. So remember, this is a noxious stimulus. It doesn't need to be noxious. It can be pleasant. This represents something that has some appraisal, some emotional appraisal of it. For example, let's say you are hearing a song for the first time, and we'll assess you if you are able to remember the rhythm, not really the lyrics, but we can also examine if you will be able to remember the lyrics. So an individual is able to remember a rhythm, the rhythm and the lyrics of a song if it had some, if they were able to connect with it emotionally. So maybe somebody can ask you, if you hear this song, what does it remind you of? Does it remind you of an unpleasant experience that you experienced in your past? Is it a sad song? Is it a happy song? Or is it just a song to pass a time? So if it has some emotional connection, you are able to remember the rhythm, how the song was flowing. But even much better, you are able to remember the lyrics. This is dependent on the appraisal. And you can translate this neurologically to suggest that the emotional appraisal is likely to be now what you can refer to as the facilitator terminal. We are having the sensory terminal as affecting this receptor over here, but for you to increase that, to increase the level of neurotransmitter that are being released, you also want some facilitator terminals. So that means you are having your limbic system over here. You are having the cerebral cortex, possibly the prefrontal area. So we want to determine if you are getting this information into the hippocampus for maybe a longer duration of storage. So this will depend on some specific part of the limbic, possibly the amygdala. You'll also be able to see the hypothalamus. So if we do not appraise this information over here by increasing the neurotransmitter, there's no way this information is making it to the hippocampus to be stored as a long term or possibly even as an intermediate, because it does not qualify, it doesn't pass the test or maybe the emotional test. So that's why it is good to have a personal connection with whatever thing that you want to learn in terms of song. It could be an art that you want to remember. Anything, you need to connect with it personally. And personally, sometimes you can relate it to some good events that you've experienced, some bad events that you have experienced. And it is through that way that you are likely to incorporate this. So what are we suggesting? We know somebody will tell you, we don't want you to think with your emotions. Well, I'll also not want you to think with your emotions, but I want you to use your emotion to advantage, to enhance your logic, or maybe not to enhance your logic, but to enhance your memory, whereby you are suggesting you are only likely to store things that are important to you. So I could be talking important things, but you might not store it if they are not important to you. And how do you make it important, or how do you personalize this? You need to have some background story. So how do you get this background story? Possibly suggested a movie, suggested going to the wards where you can be able to interact with some things, or maybe just digging into personal experience of some people. You are able to connect with some things emotionally. So when it comes at times to understand maybe this concept in a deeper way, you'll be having some emotional background. But if you don't have an emotional background and you decide to crack the nuts in terms of getting the hard concept, there might be some form of difficulty. So we've described the chemical mechanism or the synaptic mechanism. So this will be the same thing that can happen in the molecular way. So molecular mechanism is just simply suggesting that a neurotransmitter will be released. And how do you release a neurotransmitter? A neurotransmitter is normally released when you're having calcium influx. So these are some of the things that we just learned. So let's explore it a little bit just by reading. Molecular mechanism of intermediate memory. We can have habituation and facilitation. So what happens with the habituation? With the habituation, what you want to achieve is the reduced synaptic transmission, and therefore you want to limit the amount of calcium that is getting through the axonal membrane. And that means you need to close the calcium channels. So if they are closed, it means that some of the intracellular mechanisms that we anticipate to be activated will not be activated. And if they are not activated, we will not see exocytosis taking place. In contrary to that, sometimes you might want a facilitation where you want to store a memory. So when the facilitator terminal is activated simultaneously with the sensory terminals, these are some of the things that are likely to happen in a chemical way. Step-by-step cascade. Serotonin is released from the facilitator terminals. Serotonin binds to the receptors of the sensory terminals, activating the adenyl cyclase. Adenyl cyclase increasing the level of cyclic AMP or the CAMP. The CAMP increasing or maybe activating some protein kinase that causes the phosphorylation that allows the potassium channels to close. And if the potassium channel closes, it means that the action potential or the positivity of the cell will be on the rise. And as the positivity increases, it means that we'll be able to achieve an action potential appropriate for the calcium channel gate to open. So when the calcium channel gate opens, calcium influx takes place. And we know what happens when the calcium gets into the cells. The protein kinases are activated again. These which are specific to allow the synaptic vesicle membrane to attach into the mother axonal membrane, and therefore will be able to cause the release of the neurotransmitters. And this is the simple mechanism. So again, what you need to know, the limbic will be able to release a neurotransmitter. So this specific neurotransmitter, not a specific, but an example is serotonin, where serotonin, if serotonin is released, it will able to activate at least the sensory terminal to release more and more neurotransmitters. And this explains some of the mental processes that you'll be able to experience, not as a person, but secondhand from the patient. Whereby with low level of neurotransmitters, specifically serotonin, normally translate to depression. So you are depressed if the level of serotonin reduces. So you'll notice that one of the symptoms of the depression is that you might not be able to concentrate. You might not be able to register or form new memories because remember, this is how we are encoding some stuff and we are taking them out into our memory. So one of the neurotransmitters that are normally low in those people with the depressive episodes of most mental diseases are serotonin and the norepinephrine. So if this neurotransmitter reduces, we are able to see at the chemical level what will happen in regard to memory. Will not be able to facilitate the sensory terminals, and therefore you'll not be able to release the neurotransmitters. Remember, the neurotransmitters release are very important to increase the sensitivity that's serving as memory trace. The only thing is that we expect the neurotransmitter as release to be sustained, and therefore we expect our memory to somehow be much longer than the short term. So what happens with the long-term memory? We've explored the short term, the intermediate, and you can also examine the long term. So in the long term, there is actually no sharp difference between the intermediate long term and the true long term memory. The difference lies mainly in the duration and the stability. So if you are able to have these chemical changes persist for a longer duration, you are likely to achieve some long-term memory. A good way of suggesting that could be you are likely to sustain these chemical changes by forming some new neurons. That's why some other literature sometimes suggests that if let's have these two scenarios. So if you are a person A and there's some person B, you are a person A who doesn't love to read or who doesn't love to interact with the new information. And this person B maybe who reads, listens, and interacts with the new information. So if both person A and B were to have dementia at a certain age, let's say 70 years, the person who does not love to read, doesn't get much of the information, are likely to have it much earlier. So we are assuming everything is just constant. We are only comparing these two aspects. So this person is likely to have dementia earlier because they've not been reading, they've not been incorporating information, while this person with B, they are likely to have dementia later. So this is to suggest that this we are only saying that if it is only compulsory that person A and person B should get dementia. Person A is likely to get it much earlier. Person B is likely to get it much later. This is because as this person is reading and committing a lot of information into their long-term memory, they are having new neuronal physical connections, unlike the individual with the A who is not reading. So if you read and absorb a lot of stuff, it means that you are also developing some physical capability. And with the time, even though you people were born the same with the same brain, with the time the person B will be much clever, will be much receptive to information because they'll be having an increased neuronal capability. The neuronal capabilities with the expression of a lot of new neuronal circuits that will exist within the brain. So this is how this person, the person B, with the time they'll be deemed as more intelligent than person A. And why are they intelligent? It is because their behavior of reading, their behavior of incorporating information allowed them to be more receptive to new and newer information because they were able to enhance their physical capability in terms of neuronal connection. That's an example, and I don't know if you in your social media interaction, I don't know if you've come across a certain old lawyer who is able to articulate issue accurately, despite having some deficit, maybe in some motor, their thought process and their memory is still preserved. And this can also be able to suggest how some behaviors are very important. The behavior of knowledge seeking. So by the time you're having the long-term memory, it is not just about the chemical changes, but it is because of the actual structures that exist within the brain. And remember, when we are having these structural changes, it suggests that you will be more and more responsive to information. So this structural modification occurs at the synapses, can either enhance or suppress signal transmission. So much of what we know comes from the studies of primitive animals, where the simpler nervous system allows for clearer insight into memory mechanism. So what are some of those structural changes that are likely to take place so that we have the physical or the long-term memory? So we've suggested it involves some physical restructuring of the synapses, not just the chemical changes. One of the changes could be the DNA-driven protein synthesis. So as you read, committing more information into the long-term memory, you'll also be stimulating the protein synthesis that can be important for the formation of new neurotransmitters and new neuronal structures. So the key synaptic changes that are likely to happen, you are likely to have more vesicle releasing site for the neurotransmitter. This is a physical thing. You can achieve this. Increase the number of neurotransmitter vesicles, release growth of more presynaptic terminals, structural changes in the dendritic spines for stronger signal transduction. So just have a hypothetical example over here. So the postsynaptic neuron of a person who reads and the postsynaptic neuron of somebody who does not read. So if you do not read, just note that reading is just representation. We know there are many other ways of acquiring information. So if you are not acquiring information, you'll just be having these dendrites over here. So maybe you're having maybe 3. But this person who is reading or acquiring information, they'll be having more more and more dendrites. So that means next time, if a concept is suggested, either verbally or through some other way, this person is able to get this much quicker than this other person, because this person has been training themselves by acquiring information continuously, and the body was forced to adapt. So this person adapt in a more intelligent way. This person just in an average way. So we don't want to say in an intelligent, but an average way. So this adaptation enhances the synaptic strength, forming the foundation for durable memories. So this is what it is anticipated with the memories. So just a little bit extension with the memory. You can also suggest that we've suggested that the number of neurons can also vary depending on our learning experience. So the anticipation is when you use a particular neurons, they'll increase in number, but if you don't use it, they'll reduce. So in early life, the brain creates an excess neurons and axon branches. Only connections that are appropriate targets, neurons, muscle glands survive, while other degenerate. So this is what is called pruning. So pruning depends on the nerve growth factors released by the target cells. If a neuron fails to connect properly, it might die off entirely. This follows the use it or lose it principle, where only active connections are preserved. So you know, if you don't lose it, if you don't use it, you lose it. Example. So this is a good example, an experimental. Covering one eye in a newborn causes the related visual cortex neurons to die. This is because one visual cortex is normally supplied with a particular eye. So if these signals are blocked, it means that this visual cortex will not be used. And therefore, even when you restore the vision of this individual, they might still not be able to see. This is because they did not use it, and therefore they lose it. And this applies to various important of our brain, especially those that we want to control deliberately when it comes to emotions and intelligence. While once thought limited to infancy, recent evidence shows adults also undergo some degree of the neuronal organization during learning. So if you learn, you are using it, and therefore you retain it. If you don't use it, you lose it. Let's just finish with the memory before we take in questions. So this is a question, consolidation of memory. So how do you consolidate memory? So that is, how do you transition memory from the short, intermediate, and long? For now, we've been able to see. How is that possible? This should be possibly at the psychological level or a physical level through rehearsing. So rehearsal strengthens consolidation. Repeating or mental reviewing of information greatly enhances its transfer into the long-term memory. The brain tends to automatically rehearse interesting or significant information. That's why we are suggesting you need to connect with something at a personal and emotional level, whereby anytime you read on something, it needs to somehow intrigues you. And when it intrigues you, you are able to think about it, maybe in a surprised way or in a happy way, and therefore you are able to retain it even much better compared to those that you don't rehearse. So this explains why focused, deep study is better for memory than shallow learning. Because if you are focused, you are likely to have some repetition and thinking through that whatever you are reading through. You are not just reading and hearing some words in your head, but you are hearing these words. On top of hearing these words, you are able to make sense out of this. So that means you are thinking through these words. What does this mean? If you are able to debate within yourself, it means you are able to have a deep kind of studying and you are able to retain a lot of things. Why alert individuals consolidate better than those who are mentally fatigued? So this is because of the rehearsal. New memories are organized or codified during consolidation. So new memories are linked to the similar memories. And this is the same things why we suggested. So you are able to consolidate a memory if you are having a baseline, or where is this information going. So for example, you are learning about neurotransmitter process release. So that is an information that needs to be stored in the in your memory. But the question should be to an individual: where is this memory going? Does it have some baseline where it should be going? That means if the answer is yes, it can easily be incorporated. But if it doesn't have a destination to where it is going, and to where it's going, we are suggesting these are things that you are able to acquire emotionally, or some previous information. So that means it is easier for somebody to understand some neurological concept if they did biology than a person who did not do biology and maybe did history. So for the history, they don't have where this information is going because they don't have facts to relate to this information. But if you had biology, you are likely to receive this information much better and better. So we are not suggesting that you need to do biology. Sometimes you don't. Maybe this person did not do biology, but they watched a lot of movie with a lot of that has some lot of information. So anytime they are learning of neurotransmitter, they are able to relate it to what they already know. So what do they know? Not biology, but maybe they've seen a lot of movies. But better if it's biology, and your biology may be backed up with not movie, but something that you've seen physically. So you're likely to understand diseases if you know how diseases affects people in the society, either by killing or by destabilizing them. So data is likely to be incorporated if you are already having some data that can relate to it. And when we are having that data relating to it, this is what we are referring to as you are learning something that is too personal to you. It is personal because you already have a similar aspect of it within your brain. So that's how you encode memory. And that is the short term, the intermediate, and the long term. And I'll want to invite if there is any question